So there's a lot of talk on social media about cosmetic makeovers, smile makeovers. We get a lot of questions about it. So let's see what that entails. If we're talking about fast results, instant makeovers, then we're talking about veneers, crowns, cosmetic bondings, and gum lifts. When a tooth is completely destroyed and we need to restore the whole tooth, we have to use a crown in order to give it the natural look and shape. If your tooth is intact and in a pretty good condition, and most of the tooth is left, we can use the veneer option. Just covering the front part of the tooth, just making it look pretty. Veneers can be used to correct slight misalignments, chips, discoloration, and gaps between teeth. Cosmetic bondings is probably one of the most conservative ways of doing it. It's a little tricky though, because cosmetic bonding is like artistry. The misconception I get from patients when they come in for a consultation for cosmetic bonding is that they think, oh, it's just a filling. That's far from the truth. And that's why I see patients coming with these fillings on their front teeth that just looks really bad. Like I said, it's an art. It's done in many steps. We layer in the composite, we use different shades, literally recreate the tooth anatomy layer by layer. And if it's done right, it's truly undetectable. So if I were to differentiate between crowns, veneers, and cosmetic bonding, and say which one is more conservative and which one is more aggressive, crown would be the most aggressive, cosmetic bonding would be the most conservative, and veneers would fall somewhere right in between. Braces or invisible braces are a way of doing cosmetic makeovers, because a lot of times patients have perfectly looking teeth, but they're just misaligned, and just putting them in the right position would give them a smile makeover. The downside is that it will take more time to do so, but it is the most conservative way and the most natural way of doing that. A lot of times we get patients come in and wanting to do veneers. When I evaluate their smile, I find their teeth look fine, but they just look really short, or they're just uneven. And the patient may consider getting veneers to fix the problem, but believe it or not, even if they do get veneers, the problem is still gonna be there. So the way to solve the problem is a simple procedure called gum lift. That is an instant smile makeover, and it's amazing. We do provide all these treatment options at our office. The best way to find out your options is for you to come in and do a consultation. I hope this was helpful, and I hope to see you soon at our office.